Test.
What is it like? New record for me. Yes.
What time is the great debate? 5:30.
Did someone say the great debate at 5:30 tonight for all those listening to the recording?
I was hoping Will think of roasts and teaching.
Great.
What's the topic?
It's such a controversial topic that net students are better lovers.
So romantic partners, not lovers. Romantic partners. We've got to keep it PC.
I was running up the topic of lovers. It was so hard to know like what was kosher and what wasn't. Because like the topic.
Oh wait, you were helping Will do this.
I was trying to help Will think of some insults. Not arguments.
How long my period?
No, arguments are useless.
Can you say that again, Michael? Anything that's not on there, you improv.
Okay, sweet.
I just think, I feel like just reading out sort of all the qualifications that one of the PhD, National Medical Science, Honours, 25 years of lecture, that reeks of being a good law. Oh, you got it?
Fly in, fly out.
I haven't had to do it, but I've heard that it's
That's spontaneity. Working to keep things fresh was part of the way these lecturers reuse multiple choice questions.
that's pretty good.
I like that one.
That's pretty good.
Will said it was like, yeah, Will was like, I don't want to use it because we'll give away that we use it. Oh,
They all know.
They all know.
Literally openly talk about it in Paeds because it's fun.
I reckon that's fair game. Reuse multiple choice questions.
No.
It comes from names and comes from content. I hope they continue doing that. Yeah, I'm not saying it's a bad thing. I want to be fair.
Do we have anything to do?
Yeah, there's always some sort of
The signs and symptoms.
And then
Will we have a new quiz here? I don't know if
How's the signs and symptoms survey? Has it improved?
it made a massive improvement like last year.
Yeah.
Because like our first term was like that mess of like a.
Ugh.
It was very confusing, and now it's like a bit more.
Is it actually useful though?
like
It's
doing
good
it
getting like the
beforehand is a
initial.
bit.
Yeah, I mean you do some googling of terms.
Yeah.
Yeah.
It's like familiarizing.
Because we asked them to like link some anatomy and pathology to clinical skills, and they're like, but that's what you have the signs and symptoms survey for. And I'm like, but it sucks.
Yeah.
Is this everyone that's gonna come here?
There's two more.
Oh.
no.
Make them come into this. Be like, no, sorry.
Like open the door.
No, 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 for you. Welcome.
We've done about like quarter.
Oh, actually, good stuff.
We're gonna do it for
I need to get on something like that.
Maybe.
Wow, so people actually use
You
it.
guys gonna be rich?
I think it's for the assignment.
What I've actually
I
found
don't know. We normally try and pull together.
what I've found is like I actually remember
Yeah,
just like
Yeah, I exempted.
when I keep doing it by myself, even with the recording, it doesn't get in my head actually.
But tell us the subs get it
I
easier.
haven't done it yet.
Yeah.
I want to. I think we should probably. It's like
Easier to identify and heal.
Yeah.
And it's all catchy.
You always have like a third down or something.
Do you guys want to move to this table so that I can see, and we'll do like a little demonstration as well?
Well, we're landing in Bali, but then we're actually going to.
Oh, the wind.
Wind pathway.
Sorry?
Wind.
Yeah.
Like lonely mode.
Sorry.
It's like WNT. Yeah.
Okay.
Wind pathway is like
That's the
lonely
thing, we
mode.
didn't want to like give into the cliche, so.
Oh yeah, I vaguely remember that. It didn't come up in the exams. I hadn't seen it in past questions, so I didn't spend much time on it.
Yeah. It's like interesting. Like modulates osteoblast.
Oh yeah, that whole system's like very cool.
Yeah. Well, like OPG and rank out. Like the. I don't know, it's very cool.
I really liked the
Complex and yeah.
Whatever we did on the bus.
what was it? The two different types of arthritis. There were some really cool diagrams about like the signaling pathways and how they work. I remember.
Yeah. Should we start?
Yes. All right, guys, let's get started. So today we are going to be talking about pregnant women and what comes out of them. Sorry, that was a joke that my housemates told me I had to make. That I remember from phase 1. So we'll start with obstetrics history for phase 1 OSCEs. Don't forget your wipe, wash hands, introduce position exposure, and consent. So you might say something like, I've been asked to have a talk to you today about what's concerning you. Then take a full medical history, which is going to involve talking about menstruation, general medical history, and then a bit about your home life and supports. Is that okay with you? So this history in particular, it's really important to use this and use signposting, both to keep yourself on track and make sure you cover everything, but also to warn the patient, because they might come in and be like, I just want to get pregnant. Why do you have to ask me about like my diabetes risk and who I live at home with and my diet and exercise? That's not relevant yet. They should guess that you're going to ask about menstruation, but it's just nice to signpost ahead of time. So a lot of people think of an obstetric history as a thing that you do on its own, and people jump in and they do the obstetric history and then everything else is an afterthought. But a better way to do it is by integrating it into your normal history. So you've got your usual history of presenting complaint, past medical history, family history, social history, and you just insert obstetric history into either history of presenting complaint or past medical history. Insert menstrual history into past medical history, and I would also make a note of risk factors, a really important part of past medical history. Instead of calling it history of presenting complaint, it's nice to call it history of presentation, because pregnancy sometimes isn't a complaint. Some people are into that. So history of presentation. How long have you and your partner been trying? Say partner. Do not say husband. Do not say boyfriend. I had a patient in my OSCEs who I was like, oh, so do you live at home with your husband? And she's like, well, my wife and I was like, oh boy, sorry. So just get into the habit, practice it at every clinical skills session, get on top of it now, and you won't embarrass yourself later in the hospitals. Gravidity and parity, you guys know what that is, know how to ask it. How many times have you been pregnant? How many pregnancies have you had? At a phase 1 level, they're not going to throw you any curveballs like multiple miscarriages. Contraceptive use. Can someone tell me a type of contraceptive?
Oral contraceptive pill.
Beautiful, another one. Great, another hormonal contraceptive.
IUD.
IUD, yep. Another one? Yep, more?
Like vaginal, like the sheet.
Yeah. Mini pill, that's good. Any others? NuvaRing, does anyone know what NuvaRing is? It's like the ring that you insert up inside the vagina. Depot injection. It's just a fun fact. Which population at UNSW has the highest use of depot injections? International students. Seems to be a big thing overseas, not such a big thing in Australia. But yeah, But also, I guess if you like want to have contraceptive without being obvious that you have contraceptives, so your parents can't find your pill laying around or feel that you have a rod in your arm or notice that you've been like feeling like crap for a few days because you got an IUD put in, a depot is a bit more discreet sometimes. And also if someone just wants some short-term contraceptive or something as like a stopgap while they take a break from the pill or go between two different types of contraception, depot injection can be a good thing to use. That's not relevant for phase 1, it's just interesting. And have you or your partner been told of any fertility concerns? Quite often people will be forthcoming with these kinds of things in phase 1, but you probably won't get any concerns because phase 1 is about recognizing normal. So basically, I made these slides and then I realized I didn't really like the way I made them and I should have made them differently. But I think you should divide your obstetric histories into literally 2 different pages. And one is someone who is wanting to get pregnant and someone who is currently pregnant, because you'll ask very different questions in those 2. So currently pregnant, it's important to ask, how did you and your partner feel about the pregnancy? So that's a good way of scoping out if it was planned, if it was unexpected but a happy surprise, or if it was unexpected and an unhappy surprise. So never assume. That shouldn't come up as much in phase 1, but you guys are getting quite close to phase 2, and that's definitely something you need to be very careful of in phase 2. Is this your first pregnancy? And then obviously you go into the whole obstetric history that we'll do in a minute about their first pregnancy if it's not. When was your last menstrual period? That's a big thing in phase 1 that they want to make sure that you can ask and calculate, so practice that. And have you had any symptoms yet? And it's a good idea to have a list of the symptoms you need to know in your head so that you can kind of tick off a few of them. They'll be in a later slide. Oh, here we go. So normal symptoms of pregnancy. This is exactly what is listed in the phase 1 guide. I would not learn any more than this. This is plenty. Obstetric history. So if it's not their first pregnancy, or if they've come in regardless of whether they've come in and they're pregnant or they're coming in and they're trying, you should be checking their obstetric history and any past pregnancies. There's a lot of complicated ways you can go about it, and you can list like the positive, there's like lots of different structures you can use. The simplest, in my opinion, is just doing chronological, before, during, and after. So before, did you have any troubles getting pregnant? During, did you have any symptoms or complications? And then after, how was the birth? Was the baby healthy? And something that MedFac are going to love if you ask is, how did you cope with the lifestyle adjustment? And that opens up to talking about postnatal depression, which you shouldn't get in phase 1, but they really like that you're thinking about it. Past medical history. So how is your health generally? These are the same 3 questions that in the last tutorials I mentioned. So do you see your doctor regularly for anything? Have you ever been hospitalized? And have you ever had any surgeries? I always chuck medications and allergies into past medical history as well. And with those 3 to 4 questions, you're going to get pretty much everything you need. If the patient doesn't say anything to any of those questions, they probably don't have anything relevant, or they're just being a really stubborn patient, which you're not going to get in an exam. With medications and allergies, it's also really important with obstetrics to ask about vitamins and supplements. Obviously, you want them to be on supplements regardless of whether they're trying to get pregnant or currently getting pregnant, and just a pregnancy multivitamin generally has everything, including the folic acid that they need. But you're not expected to know in detail what amounts of what things they need at phase 1, just are you on a vitamin? Pregnancy multivitamin, great, sounds good. Something else that I would ask in past medical history for obstetric that's a bit different to the others, I would always chuck smoking and alcohol here, since it's directly relevant and has come up in past stations. Menstrual history. So start with an open-ended question, then move to closed-ended questions. Can you tell me about your menstrual cycle? And then all the things that it notes in your phase 1 guide. So when did it first start? This is very rarely really that relevant, but ask it. Is it regular? How long is it? So how many days of bleeding and how long between bleeding? And then associated symptoms. These are the ones listed in the phase guide. This is enough. So pain, cramping, you could say lower back pain specifically, but if you say, do you have any pain, they'll probably be forthcoming. Breast tenderness, food cravings is an odd one that's chucked in there, but I think they say like psychosocial and psychosomatic well-being or something really weird like that. But just like, how do you feel around that time? Have you noticed anything else unusual?
Sorry, just a question. If they say that they're smoking or drinking while pregnant, do you have to say anything, like, or do you just kind of ask how much they smoke or drink?
I have a future slide on that, but that is a very good question. Here we go, risk factors. So, Regardless of whether they're trying to get pregnant or they're currently pregnant, it's important to ask about STIs. Obviously, if they're trying to get pregnant, you don't want to spread them to the partner, but what's the risk of having an STI during pregnancy? Yeah. What are some particular ones that we're worried about? Probably HIV, herpes, yeah. Any others? Yeah, chlamydia. I think chlamydia is the one that can cause blindness. Double check that. But yeah, just ask, have you ever had an STI? When was your most recent STI check? And then similarly, have you ever had a pap smear? When was your last pap smear? Although it's not called pap smear anymore, everyone still calls it that. Very interestingly, I had my main case for obstetrics in phase 2 was someone who had had a pap smear, found out that they'd had low-grade SIL or whatever it was, had like a partial resection of the cervix and then had a pregnancy, and it was so high risk because there was an incompetent cervix and it couldn't really hold it in. So they had to like stitch her cervix shut at like week 12 or 13 or maybe like 20 or something, and then unstitch it at week 30 something. And it was like fine, it was a normal birth, but it was just like so high risk. So that's the relevance of that there. Hypertension is the biggest thing at a phase 1 level that you're worried about. Check blood pressure. Why do we check blood pressure in pregnant people? Yes. Diabetes is the other one. Don't bother relearning the whole stuff about like the different reasons that diabetes happens and is a concern and how it resolves. Just know that you need to check it. Smoking and alcohol. So do you smoke? How long have you been smoking? Are you interested in quitting? That's the biggest question I would recommend asking. If they're not interested, I wouldn't badger them. Just say, if you ever become interested, I would recommend it during pregnancy. It can have some health impacts on the baby. If you're interested, I would recommend seeing your GP, and they can help you with that. Similarly with alcohol, so do you drink, or have you ever drunk? How much do you drink on average? Drinking during pregnancy can have some health impacts for the baby. If you're interested in reducing your alcohol intake during pregnancy, I would recommend consulting your GP. And no level of alcohol is healthy during pregnancy or something. There's like a tagline that they use. And then diet and exercise, just because excessive weight gain during pregnancy can have a lot of impacts as well, long term on the mother, so they're more likely to have their hypertension and their diabetes persist beyond pregnancy. If they have excessive weight gain, it can also have impacts on the baby, so the baby's more likely to get diabetes and be obese in the long term. So just ask, like, what's your diet like, and how often do you exercise, and it's a good idea to keep exercising throughout your pregnancy, and we'll make sure that you and your baby are in the best health possible. Family history. So some particular things that are important in obstetric that you wouldn't find in other family histories are underlined. So if it's someone who's asking, who's in because they want to get pregnant, did your mum have any difficulty getting pregnant? Is a good one to start with. And then did anyone else in your family have history of fertility issues? And if they're already pregnant, or even if they're looking to get pregnant, did your mum have any complications of pregnancy? And do you have any other family history of pregnancy complications? Genetic conditions is a good one to ask and hit on the head. In phase 1, they're obsessed with cystic fibrosis. So you might want to chuck that in there, but it also might just scare the patient. So you can just say any genetic conditions, and they'll probably come out with it if they do have a history of CF. And do any other conditions run in the family? Social history, heads is my favorite. So what's home like? Tell me about your life at home. Are you well supported by your partner? Are you financially stable? Tell me about your job. Are you employed? They're probably not still at school or uni at a phase 1 level. They will be at a phase 2 level. And, you know, how are you going to deal with, have you thought about like working during pregnancy, looking at taking time off? What activities do you do outside of the home and employment? Diet and exercise you should have already covered. Smoking and alcohol you should have already covered. Sex and sexuality, probably a little bit weird and awkward to bring up. Like, you would generally assume that they're having sex with their partner if they're trying to get pregnant, unless they're using IVF. And sexuality, you should have probably already identified the gender of their partner, if that's relevant. Obstetrics exam for phase 1 OSCEs. There is not an obstetrics exam. You're not expected to palpate the abdomen of a pregnant woman. But since there's no exam, if you get gestation where there's a history and then there has to be something else, it'll usually have a procedural skill. So blood pressure and heart rate are very common. Peak expiratory flow and rest rate, you probably won't get as much. Urinalysis is very common, and they usually chuck urinalysis and temperature together. So definitely make a table of all the different parts of urinalysis, the ones that are relevant during pregnancy, glucose obviously mostly, but also you want to be looking at proteins because UTIs are so common during pregnancy. And temperature is a bit random, they just want to fill in time. Scenario. So I remember when I was in phase 1, I was like, why can't the tutors just act it out so I can see how it would actually be done? So Michael and I are going to do a bit of a scenario for you. I haven't been to a hospital in like 10 months or seen a patient, so this might be rusty, but let's give it a go. I'll just set a 7-minute timer. That's how long you have, right? 7 and 7? Yep, cool. Literally what he said when I asked him, I was like, can you be my patient today? And he's like, this is what I did med show for. Okay, so scenario. Jennifer is a 28-year-old woman who is trying to get pregnant. Take a history, including obstetric and menstrual history, and then take her blood pressure. Are you ready, Jennifer?
I am.
Okay, let's start the time. Hi, Jennifer, how are you?
Hi, I'm good, thanks.
My name's Dana. I'm a second-year medical student at UNSW, and I've been asked today to have a bit of a talk to you about why you've come in, and then take a full history of your medical history, but also talk a bit about your menstrual history and your home life and supports. Is that okay with you?
Yeah.
So can I start by asking what's brought you in today?
Okay, well, so I'm looking to get pregnant pretty much. I just want some help.
Okay, fantastic. Well, it's great you've come to a doctor. We always recommend that it's a good idea to see a doctor from very early on in the planning process, and that makes sure that you and your baby can be as healthy as possible. So, can I ask if you've ever been pregnant before?
Yeah, no, I had one pregnancy before.
Okay, and how old's your child?
12.
12. Oh, okay, so a bit older. Boy or girl?
Sorry, no, 9.
9, okay. And boy or girl?
That's a boy.
And name?
Philip.
Philip, okay. So when you had Philip, did you have any complications with your pregnancy at all?
Yeah, so I had nausea in the first trimester, but other than that, it was pretty much fine.
Okay, and did you have any difficulty getting pregnant?
Not particularly, no. It was just a normal birth, normal pregnancy.
Okay, so no complications with the birth at all?
No.
No, and how was Philip after the birth?
Yeah, no, he's doing fine. Yeah, just a normal little boy.
Okay,
A bit bigger now, but yeah.
and how were you after the birth?
No, it was good. It was tough, like the late nights and everything, but yeah, I made it. I'm good now.
Okay, did you have any of the pregnancy blues or baby blues as they call them?
A little bit, but it's just like anyone else.
Okay,
Yeah.
no worries. And so, how is your health generally?
I think I'm pretty healthy, yeah.
Yep.
Yeah.
Do you have any medical conditions?
I've got hypertension. No, I don't.
Okay. Do you see a doctor regularly for anything?
Yeah. Not particularly, no.
No, and have you ever had any surgeries or been to hospital for anything?
No. I'm just healthy.
Okay, fantastic. And can I ask if you are on any medications?
Like, yes. Like the oral contraceptive pill, if that's medication.
Okay. And you're taking that currently?
Not now, but I used to be.
Okay. How long ago did you stop?
Well, like I stopped like right before Philip, and then I've been on it for a little bit more, but now I'm off it again.
Okay. How many weeks ago did you stop?
It was like a year ago now.
A year ago. Okay. And is that how long you've been trying to get pregnant?
Yeah.
Okay.
Well, like for not straight after because it takes a little bit, right? But yeah, we waited a bit.
Okay. No worries. And so, are you on? So you said you weren't on any medications. Are you taking any multivitamins or supplements?
Yeah, no. So I'm taking a multivitamin.
Okay. And is that a normal multivitamin or a pregnancy multivitamin?
For pregnancy, yeah.
Okay. So that should have all of the folic acid and everything that you need, but we might just take a look at the end and check that that has everything in it that you need for your pregnancy.
Yeah, no, I've got it, yeah.
Okay, fantastic. And so you live at home with Philip and your partner, is that correct?
Yeah.
Can you tell me a bit about your partner?
Yeah, no, so he's a husband, and he's not around home a lot because he's got like a job where he has to like fly in and fly out of to the mines, but Yeah, he tries to be at home as much as he can.
Okay, that must make it a bit difficult then.
Yeah, no. I mean, yeah, I have to do a lot of things around the home.
Mm.
Yeah.
And do you work?
No, so I'm a stay-at-home mum, yeah.
Okay, no worries. And so, just having a bit of chat now about your menstrual history, because that can be quite important in getting pregnant, obviously. So, when was your last period?
Last period was 2 weeks ago.
2 weeks ago? Okay. And can you tell me a bit about your cycle?
It's just, it's pretty average, yeah. I bleed for like 4 days. It's like more at the beginning, kind of tapers off a little bit.
Okay. And how long between bleeding?
Just around like a month, yeah.
Yep. And you're fairly regular, would you say?
Yeah, I have been.
Yeah.
Yeah, now, yeah.
And do you get any symptoms during your period?
I like, not too many. It's not really that bad, but just like a bit of cramping and some cravings.
Okay,
Yeah.
no worries. So can I ask, has anyone in your family ever had any problems getting pregnant before?
Like, not really. No, I don't, yeah. Mum was pretty much fine. I don't know about anyone else in the family, really.
Okay. And any complications with your mum's pregnancies are you aware of?
Well, she had a C-section, but other than that, it was fine.
Okay, no worries. And any other things run in the family at all?
Hypertension, actually, yeah.
Oh, okay. And have you had your blood pressure checked recently?
No.
No? Did you have any issues with your blood pressure in your first pregnancy?
No, not really.
No? Okay,
It's more or
fantastic.
less fine, yeah.
And so you said that you live at home with your son and your husband is there part of the time. Yep. And that you're a stay-at-home mum. What do you do with on a day-to-day basis?
So, like, I just cook and then eat and then care for the baby. I try to get out of the house, but not too often, really.
Okay. Do you do any exercise at all?
I do yoga twice a week, but I go there with my husband, so whenever he's like out of the mines, I don't really go too much. Really.
Okay.
Yeah.
And you mentioned that you cook for yourself. Yeah. How would you describe your diet generally?
I think it's just pretty normal. Eat veggies, bit of meat, like some other stuff. Yeah, just like a bit of balance.
Okay, fantastic. And how many days a week would you say you eat takeaway or fast food?
Like 3 times. Yeah.
3 times a week? Okay. And just some questions we have to ask everyone. So do you smoke at all?
Yes. No, I do.
Yes. How many smokes would you say you have a day?
Around about like half a pack.
Half a pack a day? And how long have you been smoking for?
Since like I was 16.
Okay. And so smoking can have some harms on the baby, so we generally recommend at least cutting down or trying to quit during pregnancy. Is that something that you're interested in?
Yeah, no, like last doctor told me when I had Philip, and I tried to, but it didn't work a lot.
Yeah, it can be difficult.
Yeah.
So definitely I would recommend seeing your GP, and they can help you a lot through that process of quitting or cutting down.
Okay. Yeah.
And what about alcohol? Do you drink?
No, I don't drink.
No? Okay. And have you ever used illicit drugs?
Like a long time ago.
Okay, but nothing recent?
No, nothing.
No. And when you did use drugs, what was it and what form did you take it in?
Oh, I just smoked a bit of like weed back, like high school.
Okay, no worries. And so, you mentioned that you had the baby blues a bit after your last pregnancy. Have you ever had any other problems with your mental health?
No, other than that, I've been more or less alright. Yeah.
Yeah. Okay. Fantastic. And so, just one last question: are you immunised at all?
Yeah.
Yeah. And has Philip had all of his vaccinations?
Yeah, I think so.
Fantastic.
Yeah.
Well, thank you so much for your time today, Jennifer. I really appreciated this discussion, and we're going to move on to do an examination of your blood pressure now.
Okay.
I won't do the blood pressure because we don't have a steth. But definitely practice the blood pressure. That was not anywhere near perfect, but it kind of the flow of everything that you need to do. With the obstetric and the pediatric history and examination stations, because you have your 7 and 7 minutes, but the only procedural skill you need to do is take a blood pressure. You can definitely go over the 7 minutes, maybe even by a minute or 2, but don't like count on that and practice to that, because sometimes you can have examiners that go, okay, that's 7 minutes, move on to the next thing. It's very variable, but generally with the obstetrics ones, they'll let you go over because you've got lots of time. Any questions or anything that came up about obstetrics, history or exam?
I had like a few questions.
Yes.
So like with like the birth, like delivery, is it worthwhile asking like mode of delivery and stuff like that? Like
Yeah, so if you say, tell me about the birth, He said it was just a normal vaginal delivery. So most mums are pretty used to, like, they've been to the doctor a million times throughout their pregnancy and their birth and, like, following up with the kid afterwards. So they're used to the spiel, like, normal vaginal delivery, had a C-section, no complications.
And also, how would you summarise an obstetric history?
So Jennifer is a 28-year-old female who is presented today because she's looking to get pregnant. She has no significant past medical history and has had one previous pregnancy and has one child named Philip, who's 9. She didn't have any complications with Philip, just one episode of nausea in the first trimester that faded. Jennifer has a normal menstrual cycle, regular, of approximately 28 days, with some associated cramping but no other symptoms. She is generally healthy and eats a good diet and exercise. At home, she has her husband and her son. However, he's a fly-out worker, so she's not always supported. She has a smoking history of ex-pack years and is interested in quitting but was not able to successfully quit in her last pregnancy. She's on a multivitamin and is generally in good health and prepared, already taking a pregnancy multivitamin. I would like to follow up Jennifer with some continuing counselling about this pregnancy to make sure she remains in good health, and also follow up with the smoking. And I'd also like to look into fertility issues if she's not able to get pregnant after an extended period of time. For a 20-year-old, been trying for a year, that's like too long. So someone under 30 or like 32, if they've been trying for 6 months, it's like, okay, we'll start looking into fertility. Someone like 32 plus, other way around, 12 months for under 30, because you're like, they've got time. If they don't get pregnant, they can still get pregnant. But if they're like over 30, 35, you're like, oh God, they don't have long left. They like need to get onto it. Any other questions about obstetrics? Yeah, definitely. So there's a few things in particular that can be quite bad in pregnancy, and actually this is kind of beyond phase 1, but you should always do a serology on any pregnant woman that comes in, because you can lose immunity. Like, for example, I'm sure you guys all got your serologies checked when you started medicine. My rubella had faded, so I had to re-get the MMR. And rubella, German measles, can have birth defects as a side effect. So yeah, definitely check vaccinations. Any other questions? Nope. Cool. Let's move on to what comes out of the pregnant woman. Pediatrics history. The usual: wash hands, introduce, position, exposure, consent. I've been asked to have a talk to you today and then take a full medical history, which is going to involve talking about, this is not edited. You do not want to take a pediatric history about menstruation. Cool, I didn't edit that. The thing to remember about pediatric history is you're not actually going to get a kid in your OSCEs, because imagine like a 9-year-old sitting there talking to person after person for a whole day. That would be a nightmare. So it's going to be an adult telling you about the history of their child. You're also obviously not going to have to examine a child, but you might do the examination that you would perform on the child on the adult that's there. So history presenting complaint is quite standard. What's concerning you today, and do your Socrates. The presenting complaints you're going to get in pediatrics are most likely suspicion of asthma and recurrent ear infection. They're the two things that are kind of the vibe for phase 1. So your Socrates, you're going to be asking the usual things, like if it's a cough, like obviously not sight. Onset, how long has it been going on for? What time of day does it happen? Can you characterize the cough? Do they bring anything up? Have they had any other symptoms? Have they had colds? Has anyone else in the family been sick? For ear infections, like how often have they had ear infections? Is there any discharge? Has anyone else around them been getting them? Have they had to take antibiotics every time? That's about it. Past medical history, how's their health generally? And this is where it differs for pediatric, because you have to take an antenatal and birth history. So that's literally just asking the parent, like, how was the pregnancy? How was the birth? Were there any complications? How did they develop straight after birth? Were there any abnormalities? Like the developmental milestones, yes, know them, and probably ask 1 or 2 of them as buzzwords. But in reality, outside of exams, like people don't know milestones. What they know is that they were normal for a kid their age and they were similar to the other kids around them, or they were different to the other kids around them. And that's the best way to get that is, did you notice that they were developing slower or faster than the other kids around them? Heaps of parents will say faster because everyone thinks their kid's a prodigy. Birth history, so tell me about the birth, and they'll just say, oh, it was a normal vaginal birth, or I had a C-section. technically, according to the phase 1 guide, you're meant to ask about instrumentation, which I think is really weird. But ask, like, did they have to use any instruments to get them out? And that's the clampy things or the sucky thing. They're the technical names. Sorry? I don't know. It's in the phase 1 guide, like I read it this morning, that you have to check about whether any instrumentation was used. I suppose theoretically you could have like damaged their head and led to intellectual disability, but that just seems very far-fetched and out there, very low chance of that happening. Definitely ask about immunisation always, especially with asthma. They'll be impressed. If they say they don't immunise, just say, is this something you'd like to talk about? And they'll say no, and then just like back away, because they've definitely had a heap of doctors harass them about this before and they are not going to want to talk about it. Growth charts are something that will theoretically come up in a phase 1 exam. I've like looked through all the past stations and I've never seen it come up before, but it comes up very often in phase 2 exam. But you should just be able to look at them and see like there's the line of where 50% are and then 90% and 95%. Does anyone know at what point is it worrying? Not really, as long as they're consistently in those ranges. So you could just have like a really tall, really heavy kid. They're just like a big baby or they're just like a small baby and that's fine. But when it is worrying is when they cross 2 percentiles or 2 quartiles. But that shouldn't come up in the exam. Family history, so do any conditions run in the family, especially genetic conditions, especially CF for some reason in phase 1, and has anyone around them been ill? So, you know, have any of their siblings been sick? Have you or your partner been sick? Are they at daycare? Have any of them been sick? Social history, so obviously you're not going to ask all parts of heads to a child, but home environment is really important. Who lives at home? I don't think it'll come up in phase 1. It could. It'll definitely come up in phase 2. These are some like handy hints for phase 2 exams, by the way. Quite often you'll get like, who lives at home? Oh, lives with me half the time and lives with their dad the other half of the time. And then you're like, oh, okay, that's important to note. Or, oh, like lives at home, I'm a stay-at-home mum, well supported, great, cool. Education, I mean, they've probably already said like they're in daycare, they're in preschool. Activities, do they play? Who do they play with? What kinds of things do they do? And parents will love talking about their kids. They're like, oh, they love getting out and playing board games and play with like their cousins and always at daycare and love like socializing. Or they just sit inside on their tablet all day. It's concerning. Diet, so this is something that is really important with pediatrics, depending on the age, but particularly like under 5 or 6. Do they eat and do they eat well and do they eat vegetables? But quite often they'll go through spurts of like eating a lot and then not eating as their growth, like have their growth spurts. Exercise, don't worry about asking. Obviously, actually no, sorry. I crossed out S, but I shouldn't have. Definitely ask if anyone in the house smokes, especially if it's looking like it's asthma. But obviously you don't have to ask if the 6-year-old smokes. And then developmental history. So ask generally like, how have they developed, depending on the age of the kid, kind of know like, so what we did in phase 2, we made like a big table of like all the different 4 domains and then like the different ages and what skills you're meant to do at all of them. And then we did like one important one at each level in bright red, and we just remembered the one important one at each level in bright red. Like, do not remember all of them. And so depending on the age of the kid, just ask like, or you can also just generally kind of like vibe it. Like a 6-year-old, okay, they should be able to talk. Tell me about their talking skills. And then the parent will say like, oh, they don't talk as much as other kids their age. Their vocabulary is not great. They still like say some words funny. And like, can they write? Can they draw? Do they colour in? That kind of thing. You're probably not going to get like a 2 or 3-year-old. You're probably going to get like a 5 or 6-year-old if you get anything. So I would focus on that age range. Pediatrics examination. So there are 2 exams you are likely to get with pediatrics. One is the ear examination. So always remember to do the good ear first is something that Silas likes to emphasize. Explain the procedure and get consent. So you're actually not going to be doing this on the kid, but I have seen it like you have to do it on the parent. So you'll say, I'm going to have a look in your ear with this thing. It's called an oroscope or an otoscope. So it's going to be a little bit uncomfortable. It shouldn't be painful. I'm just going to put it in your ear. It's going to have a little light, and I'll look at your eardrum to make sure it's healthy. If you're uncomfortable at any point, please let me know. And then ask about recent symptoms. So have you had any pain in either of your ears? Which one is sore? How sore is it? And be very like, okay, if it's sore while I'm doing the exam, let me know and I will stop. Prepare the otoscope, so turn it on, shine it on your hand. Yep, it works. Look at the external part of the ear. If you look at Amy's presentation from yesterday, it's very detailed in like what you need to be looking at and what areas of the ear. That's good but not essential. So just like, is it red? Is it inflamed? Is there anything obviously like discharge coming out of it? And then there's like the pulling on the ear. So obviously you're going to have an adult, so you don't need to worry about a kid, but they might ask you to explain it. So on a kid, you just pull backwards. On an adult, you pull up and backwards because of the direction of the canal. Place the tip of the speculum into the ear and ask the patient to remain still. So make sure you do that technique that Silas shows you where you hold it like a pencil, and this part of your hand should go like up against their face like that, so that if you get bumped, you don't like slip in and push it all in. So always have like the steadying hand. And then advance slowly towards the tympanic membrane. Look at the canal wall. They'll be impressed if you do that. So say like the wall of the canal looks normal, or it looks red, inflamed, there's discharge on it, there's a lot of wax. And then adjust the angle to have a look at the tympanic membrane. Again, you only need to recognize normal. They're not going to give you someone with an ear infection, because imagine sitting there in an exam with an ear infection and students like poking into your ears all day. That would be so painful and uncomfortable. So it's going to look normal. Memorize what a normal one looks like, and like a little spiel about like it's grey, semi-translucent with a cone of light. That's it. And then after taking the otoscope out, remove the speculum, put it in the bin, and look in the other ear. This is what it should look like, apparently. It's really hard to see. Don't stress about seeing it. So I've seen it in past stations, but I would be very surprised if they had a like simulated patient who was willing to sit there and let medical students like put an otoscope in their ear all day. That would be so uncomfortable and unpleasant. So I don't think it's a very likely station. Throat examination is the other one. So inspect the face around their mouth and lips. I guess like they could have a cold sore or chapped dry lips or something. Open their mouth, shine a torch, and with their tongue normal, look at the sides of their mouth. You're probably not going to see a lot. Ask the patient to open their mouth fully and say, ah. You might have a tongue depressor, push their tongue down, look at all of their tonsils. I actually had this in my phase 1 OSCE, and the patient didn't have tonsils, and I said, tonsils look normal. And they're like, really? Look again. So keep an eye out for that. Also, don't forget to look at the pharynx, so the back of the throat. Quite often if someone has an infection, they'll have like little like pustule-y kind of things on the back of their throat. Look at your own throat next time you're sick. It's really gross. And then also don't forget to have a look at under the tongue. I'm not sure what you're meant to see, but there might be something there. That's it. Okay, Michael.
6-year-old Michael.
Kid's voice, please.
Hello. I'm Philip.
Okay.
Oh, wait, no, I'm Michael.
Yeah, you are Michael.
Oh, wait, am I Michael or am I Michael's adult?
Michael is the person you are, and you are talking about your 6-year-old son.
Yes. Oh, okay.
Make up a name for your son.
Right.
Okay. Ready?
Yep.
Okay. Hi, Michael, is it?
Yeah.
Nice to meet you. My name's Dana. I'm a second-year medical student. I've been asked to have a talk to you today. I understand you're coming about your son. Is that right?
Yeah.
Yep. So I'm just going to talk a bit about what's concerning you with your son today, and then we'll go through his past medical history, talk about a bit about his family and about his home life and support. Is that okay?
Yeah, no, that's fine.
Yep. So can you tell me a bit about your son to start off with?
He gets ear infections all the time.
Okay. That must be really frustrating for you as a parent.
Like, yes. It sounds bad to say, but it's quite annoying. He has ear infections and colds all the time, and it's really difficult to deal with. And he seems like he's in like a lot of pain.
Yeah.
Yeah.
That must be really distressing. Sorry, what was your son's name?
Bill.
Bill. And how old is he?
Bill's 6 years old.
6 years old. So when Bill gets these ear infections, what's it like for him? What kind of things does he do?
All right. I don't know, he just like always scratches and like seems to be irritated all the time.
Okay.
Yeah, so he like, I don't know, yeah, just like always pulls at his ear and complains about it.
Have you noticed that he's had a fever when he's had these ear infections?
Not, we don't really check it, so I
Don't
don't
check.
know. But
No,
like
he
he's
doesn't
had
feel
cold.
hot to touch.
Yeah, like he's had like flu, like cold symptom things. But
Okay.
Yeah,
So like a bit of a runny nose
yeah,
and maybe a bit of a sore throat.
yeah.
Yep.
Yeah,
Okay. And when how many times has he had these colds and ear
Um,
infections?
Like, I don't know, like over 10 times. It's quite often. He has,
Okay.
Yeah, he has to take antibiotics every time. Yeah.
Okay. And how often do they happen?
Every few months.
Okay. So every few months, kind of like for the last year and a half to 2 years. Roughly?
Yeah, no, yeah.
Yeah. And so you said Bill is 6 years old, is that right? So he's at school, is he?
Yeah, no, he's at preschool.
Okay. So you've noticed that this
And
has started
kindy now.
happening when he's been at preschool and kindy, is that right?
Yeah, well, it's definitely gone up.
Yeah. Okay. And do you have any other children at all?
No, just Bill.
No? And have you noticed anyone around Bill also being sick?
Yeah, well, all the kids are sick at preschool, right?
Yeah, yeah, certainly. So aside from these ear infections and these frequent colds, has Bill had any other problems with his health?
No, it's been fine, more or less, yeah.
No? Okay. So thinking back to when your partner, sorry, can you tell me a bit about your partner?
Oh, yeah. Currently separated.
Okay, I'm really sorry to hear that. And so your partner, does Bill live with you part-time and your partner part-time or?
Yeah, yeah.
Yeah. And so, sorry, he or she?
She.
She. So when she was pregnant with Bill, did she have any problems with the pregnancy?
No, it was just normal vaginal delivery.
No, didn't have any high blood pressure or any diabetes?
No.
No? And after the birth, did she have any problems?
No.
No?
Fine, yeah.
Yeah?
Really good.
She have the baby blues at all?
No.
No?
she's
Okay. And how was Bill straight after the birth?
Fine. Fine.
Yeah. Didn't have any
Yeah.
problems with his breathing or anything like that?
No, not that I know of.
No? And how's his development been since he was born?
Like, it's pretty great. Yeah.
Yeah?
Started speaking early. Yeah.
Okay. And his walking and talking was about the same time as other kids his age?
A bit better, but yeah.
Yeah. And now that he's in school, how does he go keeping up with the other kids in class?
Yeah, no, he smashes it.
Yeah. Have you noticed that he's had any more trouble keeping up at school since he's had these ear infections?
Yeah, like well, I don't know. He complains a lot that like he can't hear sometimes, but he still pushes through it.
Okay. And you said that he takes antibiotics every time he gets sick, is that right?
Yeah.
Yeah.
I'm kind of worried about that.
Yeah, it can be stressful giving medications to a child. So does he take any other medications when he's sick aside from the antibiotics?
Have that like throat like anti-inflammatory thing.
Okay, maybe ibuprofen, Nurofen?
Yeah, Nurofen, like
Yeah.
in those like cups.
Yep, and have you given him any Panadol for it as well?
No, just the thing.
Just the
that,
Nurofen? Okay, and has he had any other medications at all in his life?
Yeah. No, I don't think so.
No? And do you give him any multivitamins or supplements or anything like that?
No, he doesn't need it.
No? Okay, fantastic. And so, looking a bit more at your family, so do you know of any conditions that run in the family at all?
Cystic fibrosis. Well, not. I don't know if it runs anymore, but yeah.
Okay, so you have a bit in your family. Yep, but he was tested at birth and he was all clear, was he?
Yeah.
Yeah, fantastic. And anything else that runs in the family at all?
No.
No? Okay, fantastic. And so you mentioned that he lives at home part of the time with you and part of the time with his mum.
Yeah.
Yep. How is he at home? Is he generally pretty happy and what's his disposition like?
Yeah, no, he's just happy. Like other than like whenever he's sick, because whenever he's sick, he's not happy.
Yeah, certainly.
He gets very irritated. But other than that, he's a happy kid. Yeah.
And how's his sleep?
What do you mean?
Does he sleep well most nights or?
I don't know. All right, I think.
Yeah. Okay.
I don't know.
And does he maybe not get as much sleep when he's sick?
Maybe. I'm not sure.
Yeah. Okay.
Yeah.
And what about his diet, his appetite?
It goes through like the constant back and forth. Like
Okay.
he just sometimes loves everything and then doesn't, and then eat anything for like
Okay.
weeks. Yeah.
Is he generally happy to eat his vegetables?
Kinda. Not really.
Okay.
Yeah.
But he eats enough, do you think?
Yeah, like eventually, like he goes, through phases like where he does like eat his broccoli and like really likes it, but then he just flips. Yeah.
Yeah, pretty typical of his age.
Right. Okay.
And does he drink enough water?
How much is enough?
Probably a couple of water bottles a day.
How big are the water bottles? Yeah. No, he drinks. Yeah, probably that much. Yeah.
Yeah. Okay. Fantastic. And does anyone in your household smoke at all?
No.
No. And in your partner's household? Your ex-partner?
I'm not sure. We're not that close anymore.
Okay. Sorry to hear that. And do you know if Bill has had all of his vaccinations?
Yeah. No, he's fully immunized.
Yeah. Okay. Fantastic. Well, that's everything that I had to ask you today. Thank you so much for all of that. I certainly forgot some things. And now we're going to move on, and I'm going to do an examination of your ears, if that's okay.
Yeah. No.
Fantastic. I'm not going to do that. Oh, that's it, exactly. Cool. What did I miss? Feedback. Surely something. Let's have a look through. Okay, let's see. Socrates, so onset of the ear infections, characteristic, associated symptoms, timing, exacerbating factors.
Oh, actually, one thing. I had more concerns about the antibiotics.
Ah,
I wanted
okay.
to be asked about. Yeah.
No worries.
What were you concerned about?
I'm giving drugs to my kids every like month. Yeah.
That is fair. How's the health generally? Antenatal, birth, immunization, growth charts, meh.
Oh, what's the significance of asking like how the child sleeps? Is that just like a part of?
Yeah, it's probably not so much important at phase 1, but it's good to ask to show that you're thinking about it. So the kind of main things in a young child are how they're sleeping, feeding, and something else. Oh, toileting. So at a 6-year-old that you're going to get, not probably as much, but they would definitely say like, oh man, they're so cranky, they're up all night when they have their ear infections and they don't sleep and I don't sleep and I'm so stressed and exhausted.
Would it be important to ask, like, oh, like, how are they toileting? And it's like for a 6-year-old?
Not for a 6-year-old.
I guess they'd mention it if it was.
Yeah,
Okay.
if they had any problems.
Yeah, well, he did it earlier.
Variant activities. Oh, I could have asked who they play with. I think you had a note about that.
Yeah. No.
Yeah.
Yeah. The kids and kindy.
Yeah, and cousins on the weekend, I think was written down there.
Yeah.
Yeah. Cool. So that was everything for
Another
pediatrics.
thing I remember they really lamented was like the delivery, like when delivery occurred. So was it like early and stuff? Is that
Yeah.
right?
No, that's a good point. So if they're early, and I think it's more early than 2 weeks, then you actually consider them like, instead of being the age, this is probably a bit beyond for phase 1, but instead of being like the age that they were actually born, like the age that they were meant to be born or something like that. So like you take 2 weeks off, but after they're 2 years of age, it doesn't matter anymore. But like it'll probably look really good if you ask, were they born early or on time or a bit late? That's a good point. Any questions about Paeds history exam?
Wait, so on time is 38 weeks. For what?
38 to 40.
38 to 40. Okay,
Yeah.
so 38 like embryological and then 40 normal, like 40 like
I think it's like 38.
menstrual.
No, 38 to 40 embryological.
Right. Okay.
Yeah.
It's like 40 to 42.
Yeah.
Right. Okay.
Maybe the other way around. Check that.
Right, okay.
Don't trust me. I've just written another scenario up that's like quite common. So worried about her 6-year-old daughter's cough. It's been present for 3 weeks at this time. She's been getting colds and cough once a month. Worried it might be asthma. Take a history and then do a respiratory exam and respirate. I won't go through this as a scenario, but just for some points to particularly remember with asthma. The atopic march, so dermatitis and hay fever, always ask about. Family history, ask about triggers, so cold air, grass and dust, exercise, and know your typical presentation, which is a persistent dry cough, especially at night. Some general notes. you're not expected to take a full sexual history for Phase 1 OSCEs. I saw that Amy put it in her slides yesterday, but it says like repeatedly in the Phase guide, you do not need to take a sexual history at Phase 1. And I looked through all the past cases this morning and I couldn't see any sexual history past cases. So you should be safe, but if it were me, just because MedFac sometimes does curveballs, I would glance over sexual history notes just beforehand. But don't spend too much time on it. And they pretty much always recycle past cases, so definitely look over them beforehand. I think out of, how many stations do you have again? 8? I think like 6 out of my 8 stations were past stations that I'd seen and I'd acted out with my friends. And that makes it so much easier when you're like, yes, I've done this before, let's go. And you kind of know what you're asking for. So I'd recommend doing study with like a study group and like setting up your own mock OSCEs. So like if you live in Village, you know how they have like the big hallway and they have all the rooms across the hallway. Does anyone here live in Village? No? Cool. Make a friend that lives in Village because that's like the perfect setup to run mock OSCEs because you've got like 6 identical bedrooms that you can like cycle through stations if you get like a group of you together, or even just get 6 of you and do 3 stations and then swap. So yeah, definitely run mock stations and use past stations for your mock stations because then you'll feel much more comfortable going into it. Few notes. Vote in the MedSoc elections. Nominate someone for the President Award if you know an executive member who's gone above and beyond and deserves it. Nominate someone for the Vice President Award if you know a council member. This might be your lovely year reps who gather feedback and run OSCE Tutes for you. It might be wellbeing and charities, it might be sports, it might be academic events, academic resources, anyone, just please nominate someone. And come to the AGM because it'll be a good time and we've got good catering. And that's everything. It's like, no, it's from Southern Wok. So it's like big trays of like stir fryers and things like that.
Oh, wow.
Yeah.
Oh my god. I'll bring my container.
Yes. Thanks, guys.